Welcome back to another episode of Mouth Matters with Dr. Dom. Today I wanted to focus on talking about self-confidence. And I brought my good friend Mark back with us again. I think he'll have some good insights for you. When it comes to, when you meet someone, the first thing a lot of people notice are their teeth, if they smile at all. And if you're not smiling, people are noticing that you're not smiling. There are all kinds of studies out there about nonverbal communication, about how symmetry and aesthetics affects how people view someone. Even if, there's even studies that show that even if you aren't a nice person or you maybe aren't the best person to be around, if your aesthetics say that you're good, a lot of people will just be inclined to think so. So we want to make sure that everyone's as confident as they can be. And there are a lot of ways to make sure that you're getting the most out of your smile. So I wanted to let Mark kind of give a little bit of his insights as to his experience.
Something interesting that you're just mentioning when you said about smiling or not smiling. I worked in an agent's office. He was an agent for actors, and if your headshot didn't have you with an open mouth, he just passed along because he goes, they must be hiding something.
See you later.
That was a big thing. If you're, even if it was like not necessarily a smiling shot, if you couldn't see your teeth, or if it was cut off, there's like, the guy's probably bald.
He's bald.
Bad teeth. They were very,
There are varying shades of teeth. There's white, there's yellow, and then there's Marlboro brown.
You don't want your teeth looking like filters of a cigarette, right?
Not good.
And it's crazy because smoking was such a big thing before, and now it's very rare to see people smoke. But have you noticed the difference just by how long you've been?
I think that it's a cultural thing, smoking cigarettes. I think that not to go towards an elitist attitude or not. It's just pure, just looking at it from a standpoint of being objective, is that sometimes the more educated people are, the less inclined to smoke they'll be. That's not always the case.
They target lower income people as smoking,
and it's a shame. And the same people that get targeted with smoking are the same people that get targeted with foods that aren't that nutritious, fast foods, energy drinks, pop, stuff like that. And it kind of all comes together. But to stick with the smoking component, it's like, and the same thing with chewing tobacco, is I feel like when I'm in groups of people where there's one person smoking, there's usually another person smoking. Or if there's a person who's chewing tobacco, a lot of times when a person sees them chewing tobacco, they say, "Hey, can I get a dip?"
Let me in on that.
And it's kind of funny, is not to say that misery loves company or anything like that, but I think.
And it's also too where people live. Like I noticed, definitely in the South, people smoke more because it's tobacco country. But when I was in Southeast Asia, everybody smoked.
Crazy.
And they smoked indoors. They smoked in elevators. They didn't care. They smoked everywhere.
Yeah.
And it was like, it was just accepted. And I think, New York was one of the first places to ban indoor smoking. And I remember thinking it was like a rights thing. Like, oh, they're taking away our rights. And I didn't even smoke. And I was so upset about it. And then once they quit smoking, I was like, this is great. And
I would never want anybody to think that I think less of a person if they smoke or chew tobacco. Some of my best friends smoke, some of my best friends chew tobacco. Not an issue for me. We can get back to that as far as some of the health stuff goes. I wanted to talk about what I personally, and Mark gave me permission to talk about this, what we did for Mark's front teeth.
Yeah, my front teeth. A long time ago, I busted them all out.
Oh, really? I don't even think you told me that.
I cracked them all, and I had to have them repaired. Mm-hmm. And then there started to become an issue. You can speak better on
so
that.
He had some staining. He had some other things going on along the edges of the composite that we use. It's a composite material to do basically a cosmetic filling on the front of the teeth. And if you smile, Mark, I don't know if we have a camera in on this for everybody just listening in. I'm pointing to Mark's teeth. Mark, right in the middle. If you ever see someone's teeth, like right in the middle. There was more darkness, and there was like a line across the front of it. If you can imagine a tooth, if you cut it in half with a horizontal line, they basically had that little delineation where people might not realize what they're looking at, but they're seeing something that they know isn't right, or they might just give them the feeling of you being not clean. Okay, and that's a big one, whether you're in the world of acting, comedy, or if you're just looking to make a good impression on a first date or a job interview or something like that.
Well, just you talking about the teeth, I started covering my mouth.
That's the natural. That's the natural thing.
Like,
But they are beautiful now. With that, if you wanted whiter teeth or something like that.
Well, let's hear.
Well, this is Dazzle Direct Professional Custom Whitening. This is basically my attempt, kind of to mimic what I'm doing in our show here by letting people know about the truth about dentistry, things that you might be curious about. This is the exact same process that we use in the office to make you professional whitening trays that you use prescription grade whitening products with. So basically, I send you this, you take your own impression, and then you send it back to us. We give you the return label, and then next thing you know, you have your custom made trays with your bleach at home.
How often would somebody want to do this?
We give you enough to do it every day for 2 weeks. After you've done it every day for 2 weeks, believe me, you won't want your teeth any whiter. it's like my teeth, for example, are pretty white, I think, and I haven't whitened in over a year.
Wow.
So and I have this habit here that I don't like to admit too much, but even with that, my teeth have still maintained a level of whiteness, just basically from brushing my teeth normally.
Wow.
Yeah. So once you get there, once you get to the point where you're there, then we'll do it. Our website is dazzleddirect.health. My website for the show here and for my dental practice is lombardismiles.com.
You guys should follow him on Instagram, Twitter, Facebook. Follow him on everything because we're going to be doing all kinds of fun stuff.
I want to be available to you. That's my entire thing. Is that
send questions? I'll answer you.
I feel like that people deserve to be able to use my experience and my knowledge. And I think that everyone thinks that their mouth is worse than it really is. And walking around with that kind of shame and and embarrassment or not smiling enough is no way to live your life.
Yeah, it lowers your quality of life, and not
absolutely
just because you're not as happy.
Absolutely, I kind of have this thing where I kind of lean on the quote of "life without smiling isn't life at all." And it's true, if I have patients who have taken the plunge and done, whether it's just whitening or a bigger cosmetic procedure like veneers or a functional cosmetic case with maybe bridges and crowns, which I'm going to explain more as to how these procedures work and how what you can expect cost-wise, things like that. But once they go through with it, you can almost feel the tension lift off of them. And then they actually smile. People tell me, I got to learn how to smile again. I forgot how to smile. I have a patient. We'll call him Patient X. He
has mutant powers.
He's a great guy. He has this mustache, right? And he's always had this mustache his whole life. And his teeth, weren't like terribly decayed or falling out or anything like that. It was just more of a staining issue. It was more of a color quality issue. He had taken some antibiotics when he was young, when his teeth were developing, tetracycline antibiotics that caused this gray staining with like a sort of a banding, if you could imagine, like a gray rainbow, basically going across his teeth. And so what we did a case where we did 10 crowns, right, all the way across from premolar to premolar. So if you're looking at someone's smile, basically where you stop seeing their teeth visibly when they're smiling, that's how far we went. So we do this procedure. He gets the new crowns on there, and he said, "I'm going home and I'm shaving this mustache," because he doesn't want to hide it anymore. And like the fact that can have that kind of a monumental change on someone, That's why we're doing this.
And the other day, you told me a story about an older patient you had in.
Oh yeah, it's a big deal. You know, you're when you talk about aging, you know, what are the things we enjoy as we age? We enjoy our family, the people around us. We enjoy eating. We enjoy.
I'm doing that now.
You know, and as we age, we don't want. I just got that. And as we age, we don't want to be held back nutritionally, so we need to be able to eat. The worst thing that can happen to a person as they age, in my opinion, is getting dentures, full regular dentures. It's not an alternative to your real teeth. It's merely the best we have when you get to a certain point, or if you're not willing or have the resources to invest in yourself. So what I do is I try to at least use the teeth that are there. You know, say you're missing half your teeth. At least we can use those teeth that are there, that are your own teeth, with those roots as a foundation, and we can build up onto that foundation and make you look good and make you bite functionally. And then all of a sudden, when you're aging, you're not just eating mashed potatoes, and you're not just eating things that you don't need to chew, because the healthiest things for you, fruits, vegetables, low fat meats. You know, I'll have a good steak every once in a while, of course, but those are the things that give you that vitality. You are what you eat, you know. So,
all right, we're talking about confidence. We're talking about making yourself happy. You have new shoes every show.
Well, my mother and father.
I'm wearing my filthy canvas slip-ons.
My mother and father don't approve of my shoe addiction, but I feel like if I'm walking in something that I'm comfortable in, I feel confident in, I'm giving the world a better version of myself. But that's my excuse. These are the Adidas Ultra Boosts. The Parleys, actually, these are made out of ocean plastic.
Yeah, you're saving the world too.
So we can say that that's a good excuse for these ones.
You saved the world.
I have to thank my buddy Tyler, who is one of my shoe advisors. We were in the store, and I've always been kind of a Nike guy, but he made me try these on, and honestly, the most comfortable shoes you could get. So I have a few different colors of these. Not all ocean plastic varieties, but I appreciate you bringing that out, Mark. You know how much pride I take in it.
I'm a fan of it. Every time I see you got new shoes on.
Well, I'm a fan of seeing you smile with that beautiful smile,
my new teeth.
And you know, only reason I know that anything's there is because I did it. I want to thank you guys so much for listening into this. If you have an interest in making yourself look better, feeling better about yourself, send me a picture of your teeth. Send us a picture of your smile. Open your mouth. Count how many teeth you have left in there. These are all things that kind of lead me to even advise you on what you could do. A lot of the time, all you really need is a checkup, a good cleaning, and maybe a little whitening. And that's something that has led me to want to give people the opportunity to do this at home, because I know how much people don't like coming to see me. Unfortunately, they like me. This is what I'm told every day. They like me. They don't like what the idea of what
they want to see you on different terms.
That's right. That's why you get me through the camera. You're not nervous. But thank you so much. Please be sure to keep looking for us on Facebook, Instagram, Twitter, all these things. LombardiSmiles.com.
Send your pictures, the good, the bad, the ugly.
We want to see them, and that's how we can really, if you take the step to be open with me, that's when I can take a step to tell you what is possible. So I'm looking forward to it. Thank you so much for being open and watching what we have to say.